Each year, nearly 800,000 Americans are affected by a stroke. And that's why CHRISTUS Health is encouraging you to recognize the signs and symptoms of a stroke. KLTV 7's Kristine Guevara explains.
An ischemic stroke makes up 87% of the stroke population.
It's literally from a clot, whether it's coming from the heart, whether it's coming from a plaque off the carotid, that gets stuck in a vessel in the brain, not allowing blood and oxygen to get past that clot. And so that area of brain that's not getting blood and oxygen starts to die.
The other type is a hemorrhagic stroke, which is literal bleeding in the brain. The CDC estimates someone in the U.S. will have a stroke every 40 seconds, and every 3 minutes and 14 seconds, someone dies of the disease. Common risk factors include an irregular heartbeat, hypertension, diabetes, high cholesterol, smoking, and physical inactivity, and unfortunately can happen at any age, as young as 15.
Because when you think about the risk factors in the sedentary lifestyle, you're shifting risk factors to younger populations than that 50, 60 years old.
An acronym to remember when recognizing the symptoms is B FAST. Balance, to watch for dizziness or loss of balance. Eyes, to check for vision loss or double vision. Face, to look for an uneven smile. Arm, to check if one arm or leg is weak. Speech, to listen for slurred speech or difficulty speaking. And time, to immediately get help. But CHRISTUS Health says 80% of strokes are preventable.
And so it's making that annual appointment, knowing what your numbers are, knowing your risk factors, and then taking your medications and being compliant.
Kristine Guevara, KLTV 7 News.
And the folks at CHRISTUS Health tell us the recommended time from hospital admission to treatment is 60 minutes, but many centers have been able to exceed that with a time of less than 30 minutes.